The following segment is sponsored by Citron Cardiology. We're joined today with Dr. Ben Citron. And Dr. Citron, last week, of course, we talked about prevention by intention. Now we're talking to test your chest. So following an evaluation, what are some common tests?
Well, the most common test here is the EKG. That's where we put electrical wires on your chest and we look at the activity of the heart and we look for pattern recognition, whether somebody's had a heart attack in the past, they have an arrhythmia, or they have some warning signs for future events. And then the next test we do that's fairly common is what's called an echocardiogram. And that's an ultrasound of the heart. And what we do is we put a small probe with some jelly on your chest. It's non-invasive.
Okay.
And we look at the heart with the ultrasound. And it will show us the wall motions of the heart, how it squeezes, the valves, whether there's leaks or not. And if there's any abnormalities, occasionally we may see a tumor or a hole in the heart, and we evaluate that.
Okay. What kind of tests may reveal possible blockage?
Okay. So that's probably the most frequent reason for seeing a heart doctor is to have a stress test to make sure there's no blockage in the heart. And what we do in that situation, we make a choice between 3 tests. The most common test is just a regular treadmill stress test, very similar to the one that people work out on all the time. We put somebody on a treadmill and we put it at a certain speed and elevation, and we just do that every 3 minutes. We raise the speed and the elevation of the stress test. And we look at 3 things: how long the person exercises, whether they have symptoms, and whether there's any changes on the heart tracing. That test is pretty good about 50% of the time. So as a result, we do other tests. We do a stress echocardiogram where we take that same ultrasound and we look at pictures before and after you're on the treadmill to see if any of the walls of the heart show weakness with exercise, and also to evaluate whether or not there's a blockage.
Okay.
And then the third test, which is a fairly common test, is what we call a nuclear stress test. We actually will inject the patient with some radioactive material, a very small amount. We look at the pictures before exercise, we put them on a camera, and then after somebody exercises, we inject them again, and then we take other pictures. And the whole idea here is that if there's a blockage, when you're at rest, the blood's flowing freely to the heart muscle, but after stress, exercise, or something else, the blood can't flow down a blocked vessel because there's too much blockage here to allow the blood to get to the heart muscle.
Okay, and you were mentioning before about testing someone exercising on a treadmill. I actually have a neighbor who used to work out on a treadmill every day. Now she no longer can. So what if a patient cannot exercise on a treadmill at all?
Well, the good news is we have a lot of medications that can simulate exercise, and we can give them intravenously, and those medications are almost as good as exercise, although nothing's quite as good as being on a treadmill.
Right. Okay. What other tests are available, Dr. Citron?
Well, one of the great things about cardiologists is we always have tests. Some of the other tests that we use are CT scanning, which is a good test, which actually can almost look at the heart as well with a CT scan as it does when we do catheterizations and such, but it doesn't really give us any indication of how somebody does when they're exercising or moving about. And then also we use MRI in some instances to evaluate as well.
And then lastly, how do you put all of this data together?
Well, I think that goes back to being a partner with your doctor and finding somebody you know and trust, and working with him or her to come up with the best course of action for you.
Awesome. Thank you so much, Dr. Citron. And check your screen if you would like to make an appointment with Dr. Citron as well.